This is Dr. Rabinovich. I'm an owner of Dental Muse, the dental practice in Castle Pines. And the reason for my video today is I've had quite a few people reach out to me in this past week with questions or concerns because dental offices were the first ones asked to close down because of the aerosols in the air, and we certainly didn't want to contribute to the spread of this virus. And so I've been at home for a little bit. So I've been able to answer questions of people who are not even my patients, but they heard that I offer consultations, and people have reached out via texts and emails and messaging. However, we're here, we're answering questions. And so what's happening is people were left with incomplete work in their mouths because dental offices were forced to shut down, and people are concerned with temporary work in their mouth. How long can they go, and are they going to lose their tooth? And so I've been addressing those issues, and one of the patients suggested that I do a video because so many patients have reached out, a lot of them with the same problem. So what we're going to do is maybe do a weekly video addressing your concerns, anything that you may have always wanted to ask the dentist and were too embarrassed, or never had time, or haven't been to the dentist in a while, and all of a sudden issues have come up. So we're here to answer them. Anything that's more urgent, I'll definitely address personally via phone or text or message, however you choose to communicate. Other than that, I'm going to answer some of the more popular questions on a weekly video. So today I'm going to talk about and address the issues that people reached out to me for. Hey, I have this temporary crown. How long is it going to last? Am I going to lose my tooth? The short answer is, and a comforting one, is no, you're not going to lose your tooth, provided you do the following. And the following is keep it clean. And it sounds a lot easier than done because it sounds simple, but very few people do it properly. So keeping it clean, you definitely want to brush. Brush by the gum line, brush well, brush twice a day. Now that you're at home, you can brush up to every meal. But if you want to keep your teeth healthy, especially those with temporary restorations on them, that's what you have to do. You also have to floss. Now, I know many of them were probably told not to floss around the temporary, which is fine when you're using it for just a few weeks, not fine when it's indefinite and you don't know when you're going to get a permanent restoration on the tooth. The key is, once you insert the floss, don't pull it back out. You'll pull the temporary out with it. Let go of the floss through, which means you can't use floss picks, because the only way to get it out is by pulling it out, and you will dislodge the temporary. So insert the floss in between teeth, let go of one end, floss through. It'll get the food and whatever plaque in between the teeth get stuck in, but it will not, hopefully, dislodge the temporary. The other thing you want to be aware of, now that a lot of us are at home, it's easy to snack on things that aren't good for you. And we can make all kinds of excuses. Hey, I'm depressed. There's a lot of crazy stuff going on out there. I'm just going to snack on this. And it's okay, but keep in mind, you don't want to sacrifice your teeth for it either. So it's fine to have coffee in the morning with your breakfast. It's not fine to be drinking it throughout the day. You're basically bathing your mouth in something acidic. And if you add any sugar to it or milk, still sugar, it's definitely not good for you. Same goes for soda. Enjoy your soda with your meal if you choose to have it, but don't be drinking it throughout the day. So mouth has an ability, or teeth rather, have an ability to rebuild themselves, to remineralize, but the environment for that has to be a very favorable one, meaning the pH in the mouth has to be neutral, pH of 7, which is about the pH of water. Most things that we eat and drink are not neutral. They're mostly acidic. So coffee, soda, soft drinks, juice, no good. You don't want to be drinking it throughout the day. If anything, just to make sure that you still have teeth when all this is over. So enjoy it with your meal, but have water all other times, or at least get in the habit of brushing well afterwards. Now, if the temporary does dislodge, don't despair. Not the end of the world. Please don't go to urgent care or emergency room. Number one, probably not to expose yourself to possible virus. And another thing, let the professionals worry about life or death situations. Teeth can wait. Teeth we can help you with. Call us. We can see emergencies if deemed necessary, but there are things that you can do at home to help yourself as well. Other than not chewing on anything sticky like caramel, sourdough like bagels, and pizza. Chew on the other side where you don't have anything temporized. But if it does come out, you can run to the pharmacy and get temporary dental cement if you have to. In a pinch, toothpaste works great. So what you do is take the temporary out, clean out whatever food or leftover cement that's in there. Make sure it's nice and clean. Before you put anything else in there, make sure you know which way it goes, because the last thing you want to do is put cement in there and then fumble with it until the cement sets, and then you can't do anything with it and you have to start all over again. So make sure you know which way the crown goes. Make sure it's comfortable when you seat it. Make sure you don't feel it too high when you insert it. Then you take the crown, you dry it, and just a thin layer. You just want to coat the inside walls of the crown. You don't want to put a bulk of it, because you're going to end up with a big mess in your mouth with cement stuck between your teeth. It's a mess you don't want to be dealing with, plus you're probably not equipped to deal with it either. So you want to just coat the inside of the crown, a thin layer, put it in, bite on it, make sure it's comfortable, bite on it a few times to make sure it's seated. Take a Q-tip, clean the excess out so that it doesn't sit. Use the floss to clean the cement before it seats in between teeth also, but do the same as I've mentioned before. Insert the floss in between your teeth, let go of it, floss through. Don't pull it out. You'll dislodge it temporarily before the cement sets. So kind of counterproductive. So that'll tie you over until you can see your friendly dentist and have either a permanent one or temporary properly cemented. I think that's it for now. Again, if you have any questions, burning questions, anything you want to know, you always wanted to know but were afraid to ask, let us know. You can message me on here, you can email us, you can text us. The phone number is listed, does accept text. I will not use any names. I will either address it privately if it's an urgent matter, or I will address it via one of these weekly videos. See you soon.